So we are doing oxytocin today. So what is the origin of oxytocin? That's the first question. What is the origin of oxytocin? So we are doing oxytocin. So the first question is, what is the origin? What is the origin of oxytocin? So basically the origin is posterior pituitary, right? What is the other name for the posterior pituitary? Hello, we are not in change. Mona, what is the other name for the posterior pituitary gland? Yeah, it's neurohypophysis. Neurohypophysis or hypophysis. So the neurohypophysis is what? The two important hormones, ADH and the oxytocin. What is the name for oxytocin? Pitocin, excellent. So it is called pitocin. Pitocin is the other name for oxytocin, guys. And then I told you that. So this one is also called pitocin. I told you that we have a synthetic oxytocin, the one that is produced in the industry, which is called syntocin. You remember it? Yeah. So the synthetic one, these are the things that you just have to remember. Because you find the next year, they won't teach you. You get the point. So I don't want you guys to make the same mistake that you do. So synthetic is there. You have syntocin. So it has a similar kind of mechanism as oxytocin, as that of oxytocin. So now we'll talk about the detailed history of oxytocin, or what are the major functions of oxytocin. If we remember very well, we talked about the specific nuclei, because these hormones are produced where? In the hypothalamus, and then they are stored where? They are stored in the posterior pituitary. They are not produced in the posterior pituitary, but they are produced in the hypothalamus, then they are stored there. They are only secreted when they are needed.
But then the origin is through the posterior pituitary.
Sorry?
But then the origin.
No, that's not true. The true assertion is that they are produced in the hypothalamus. So when they are produced in the hypothalamus, they are stored in the posterior pituitary. So it's supposed to be the hypothalamus. So when they say the origin here, what they mean is that where they're coming from when they're needed, but where they just come from, where they descend from is the hypothalamus, specifically from the two important nuclei that we talked about. One. So we have two nuclei that secrete what? Which nucleus secretes ADH? Or which nucleus secretes ADH? Doko Sharon. Which nucleus secretes ADH? Mutinda. ADH. You are not Mutinda.
Oh, supraocular nucleus.
So supraoptic. So supraoptic nucleus is the nucleus that secretes what? ADH. And then paraventricular is what? Oxytocin. So these are the things that you shouldn't forget. So paraventricular. How to remember the paraventricular? So office of the president is the mnemonic. Meaning oxytocin is produced by the posterior aspect as well as the paraventricular nucleus. When I forgot this, that's why I laughed at you. But I wasn't expecting that you would forget this. So yeah, but remember what I told you. Regardless of this assertion that ADH is produced by the supraoptic, while oxytocin is produced by the paraventricular nucleus, I told you that all of them, help each other in the production of the respective hormones. You find that also the paraventricular, it plays a very important role. It has a minimal production of ADH as well. This also has the supraoptic also secretes part of the oxytocin. That's why in anatomy there's a question that comes there, like which of the following is true about endocrine? Then they'll be like, what they say is like ADH and oxytocin are produced by the supraoptic nucleus and the paraventricular nucleus. You get the point? Without putting respectively. So this is correct because what I'm saying is that ADH is produced by the supraoptic nucleus, but this also adds some for this to be made 100%. You get the point? In assumption, we can assume that 95%, so that people understand, is produced by the supraoptic nucleus, and then this one adds 5% for ADH. You get the point? This is true for this one. Oxytocin is mainly produced by the paraventricular, but the supra adds some amount of oxytocin. Are we together? But if they bring a question like respectively, that's wrong. You get the point? Because what they are simply telling you is that oxytocin is only produced by the para, while ADH is only produced by the supraoptic nucleus. Yes. These two nuclei are located in the hypothalamus. Are we together? Good. So that is very, very important to remember. What else? Again, I told you that we know that ADH is what? Antidiuretic hormone. So oxytocin has also antidiuretic effect. That's what I told you. That is why when you overdose it, you give it in a woman during labor. It leads to pulmonary edema because it leads to water retention. Remember the effect of ADH. So it can lead to pulmonary edema, it leads to hypertension. You don't give it in somebody who is in a woman who has a cardiac disease. For example, they have cardiac heart failure. Their heart does not pump blood properly. So now this is a woman who has the cardiac failure, who has the heart which is failing. Then you give them oxytocin. What happens is that oxytocin will keep on retaining water. They are overloading water in the heart that cannot pump a little amount of blood. You can kill the patient. You don't give it in somebody who has a cardiac failure. Oxytocin. These things I'm giving you, they will not teach you. Just remember them. So those are more like the little things that you need to remember about oxytocin, but I can start reading for you guys. The hormone is synthesized in the paraventricular nucleus in the hypothalamus and transported through the hypothalamo-hypophyseal tract to the posterior pituitary to be stored in vesicles together with the neurophysin 1. Chemistry. It is a non-peptide. It is a non-peptide. That is not important. What is important is the mechanism of action. As a medical student, you need to know the mechanism of action. So that when they tell you that this is an agonist, what is an agonist, Dr. T?
An agonist is the one that imitates a particular something.
Yeah, it mimics. So if we say oxytocin agonist, meaning these are the things that mimic the effects of oxytocin. So if we say dopamine agonist, for example, from tryptophan, meaning it mimics the effects of dopamine. Are we together? Yeah. So the mechanism of action, I explained this, I already taught you this. So the mechanism of action of oxytocin. So the mechanism of action, remember I told you now, this is the neuron. So these are dendrites. Dendrites. They are the ganglion, the soma, which is the cell of the soma. and then you have the axon ion, and then you have the axon, then you have the synaptic terminal, or you can just call it the nerve terminal, or you can call it synaptic, the patterns, like nerve patterns, or nerve terminals, or the patterns. So what happens is that action potential is produced from where? From the axon ion. When that action potential is produced, it has to move along the axon. So as that action potential, remember these cell bodies, as when we're talking about the hypothalamus hypophyseal tract, what we mean is that this part is where is in the hypothalamus. While the other part is located where? In the posterior pituitary gland. So this is located in the posterior or the neural hypophysis. The neural hypophysis. So now, what we say is the action potential has to be moved from this side along the axon until it reaches this side. But what you need to remember is that the hormones or neurotransmitters or whatever are produced in the cell body. Because this is why you have the mitochondria, you have the liposomes in the cell body, you have all those cell features. The endocrinal reticulum, the Golgi bodies, those are located in the soma or the cell body of the neuron, which is located in the hypothalamus. This is the nucleus. The nucleus is also here. So the nucleus is located here. For example, so this is our nucleus. We have two nuclei. But it's not one. So you have the nucleus here. That nucleus is 40. If you are talking about oxytocin, it's ventricular nucleus. So this nucleus is secreting what? Oxytocin. When it synthesizes oxytocin, what happens is that oxytocin will be put in vesicles. And then it will be transported along the axons and find itself in the posterior pituitary in vesicles. So now what happens is that when you need that oxytocin, due to the stretching that occurs during childbearing or birth, what happens is you are going to have an action potential that is produced in the axon ion. When the action potential is produced, you remember in second year physiology, that action potential came. And the one that has depolarization, the spike, it has depolarization, hyperpolarization, absolute what? Refractory period and relative, those things. So, action potential is, so that action potential is going to move along the axon ion. So it will move. This is action potential, right? So action potential in layman's terms is just voltage, right? It's voltage. It's more like electricity. So that action potential is on the air. It has to come this side on the presynaptic node or terminal or the pattern here. So if we expand here, we expand the terminal here, we bring it here. We assume that it's like this. This is our left terminal. And then it's connected to that. This is our axon. We're just assuming. So this is this thing there, the terminal, right? The nerve terminal. We are magnified it here. So now, this nerve terminal has got receptors, has got a channel which is called calcium voltage. Calcium voltage gated channel. So calcium voltage gated channel, right? So this channel depends on what? On voltage. That's why it is called calcium voltage gated channel. So this channel only opens whenever there is a voltage, which is an action potential. So when that action is moving along the axon ion, as it is approaching the terminal A, what happens is that it triggers the opening of this channel. But remember what I told you, this same very this same very terminal stores what? The vesicles that consist of what? Acetylcholine, the neurotransmitters, anything that was produced in the soma is stored in the vesicles here. So you learn about oxytocin. So oxytocin is stored in the vesicles. So what happens is that whenever the calcium channels are activated or they open due to the action potential, right? Action potential that is moving along that iron. As it approaches the nerve terminal, it triggers the opening of calcium voltage-gated channels, and that leads to an influx of calcium because calcium is more on the outside than the inside. So calcium moves now. So calcium is that influxing here. You have calcium here. You have calcium coming here, calcium here, calcium here. So now what that calcium does, it triggers the release of those contents now by fusing these vesicles with the membrane this side. At the end of the day, the neurotransmitter or whatever, the oxytocin is going to be released now. This is going to be oxytocin. So this is how oxytocin is released, or ATH is released, or acetylcholine is released. The same thing is through the action potential, which opens the voltage-gated calcium channels. Influx of calcium triggers the release of the vesicles that are carrying anything. In this case, we're talking about oxytocin. But that is not the mechanism of action. The mechanism of action is where this thing is going to work on. This is how oxytocin is released. So how is it produced? It is produced in the soma, or in the cell wall, in the paraventricular nucleus, which is located here. And then it moves, and it gets stored in the synaptic terminal. You get the point. So when it's needed, the action potential has to be generated. Along that, what moves? Action potential or the vesicles? They move, they are just transported here. We talked about conductors, there's axoplasm, what those things that we discussed last year. They are just transported. Yes, in fact, they're supposed to move naturally. From here, they're just produced here, then they're stored here. But what I was trying to tell you is that this is the hypothalamus, this is the pituitary gland. So this is connection is called hypothalamus. Hypophyseal tract. So you have the hypothalamus, the hypophyseal, which is the pituitary. So hypothalamus and hypophyseal tract. The tract is a bunch of collection of what? Fibers. Yeah, nerve fibers.
So I think is oxytocin only produced when it's needed, or it's produced and then stored as a sort of reactive form?
There is what?
To wait until it's actually needed.
No, they are produced. When they are produced and then they are just stored there. They are only released when they are from EAS, but when they are produced in here and then they are stored there. That's the normal physiology of anything. Neurotransmitters acetylcholine, they have to be produced in the soma, cell body, because you have got all those organelles on the cells that are there. So when they are produced here, they have to be stored there. When they are stored there, when they are needed, that's when it's integrated. For example, acetylcholine is the same mechanism. It will be produced in here. When it's needed, this is the mechanism that is going to happen. The influx of calcium, then calcium is going to trigger the fusion of these membranes. The vesicles with the membranes at S, the acetylcholine is released. The same principle is what I'm using on the release of this. Are we together? So I touched the part of the mechanism last time when we met. I told you about the G protein receptors. The tutorial is 30 minutes, right?
Yeah.
Okay. So I told you about the GQ and the G stimulatory pathways. You remember, right? So I told you that you have what you call primary hormones, primary messengers and second messengers, or first messengers and the second messengers, isn't it? Is it secondary or second? Second messengers, right? So for example, when oxytocin is produced, oxytocin is going to act as the first messenger. For anything to happen, for example, the oxytocin is produced somewhere in the hypothalamus, it comes in the pituitary, but for it to go and work on the myometrium, isn't it? The myometrium, which is the smooth muscle part of the uterus, right? So for it to go and work there, what happens? What triggers that contraction? You get the point. So this one works through what you call the phospholipase C, or the GQ. Remember the GQ pathway? So this is the GQ pathway. I talked about this everything. It's a video to you guys. I talked about this diagram. So yeah, this is the GQ protein coupled receptor, which is bound to GTP, bound to GTP, and then it's a receptor. So they are the enzymes. So the GQ coupled protein receptor. So it's coupled with the GTP. That is why it is called GQ coupled protein receptor. So what happens is that when oxytocin binds in, this receptor that was not active will be activated. You get the point? It will be activated and it becomes GQ protein coupled receptor with GTP. Mona, we did this last year. Even this year, I talked about this. Should be 2 weeks ago. So this becomes GTP, then it's active. And then it will move along the membrane and find where the enzyme is. The enzyme is not active. So the enzyme, when this comes here, it activates it. So remember here, when it's active, it is GQ, then it's as a GTP. Isn't it? Because it's active.
GTP, that's the active one.
Yeah, GT, remember here we have GQ protein coupled receptor with GTP. So when oxytocin binds there, it triggers the addition of another phosphate on the GTP, which becomes GTP. So that phosphate is gotten from the ATP. That's why I say it activates it from ATP. So that one becomes GTP. The activated this receptor, the coupled receptor, is one that is going to activate the enzyme that is not active at that moment. So the enzyme that is not active at that moment. So now the enzyme is called phospholipase in the GQ pathway. In the GS we said it's adenylate cyclase. And then the second messenger was CPKMB, right? You guys are forgetting things. So this will activate the phospholipase enzyme, which was not active. And then that phospholipase enzyme works on this phospholipase. So it will convert phospholipase into two. You are about to call that and IP3. I don't know if this is correct, but that's how it's supposed to be. So the phospholipase will be converted to DAG and IP3. DAG is diacylglycerol. diacylglycerol. IP3 is inositol triphosphate. Inositol triphosphate. So what these do in simple terms is that the dye can go to the sarcoplasmic reticulum, which stores calcium. So it will come to this one and tell it to release calcium. So calcium will start coming out here. Now you get it. Yeah. So this dye activates that. And then IP3 direct, it activates what we call should be PKC. No, PK is in the distributed pathway. In the GQ it's PKC. PKC is protein kinase C. So this PKC can go into the nucleus. This is the nucleus, for example, and activate what we call the transcription factor, so that the nucleus can produce something. This cell PKC can come to the membrane and open, put some channels there. Those channels are going to be, therefore, allowing something to enter or leave. For example, if the tell us that to release calcium, you get the point, release calcium and calcium above the cell. At the end of the day, the GQ stimulated pathway is mainly for calcium. So when that calcium is produced, is what is going to lead to muscle contraction. Because you know, for the muscles to contract, you need to have the calcium there. So the mechanism of action of oxytocin is like that. It binds on oxytocin receptors and triggers the myometrial contraction by increasing the what? Intracellular calcium levels.
So it's the one that's this mechanism happens in labor, the contraction happens with people.
Because labor, what I said is that because labor, there is that interaction between the mother's passage and the passenger, which is the baby, isn't it? So there is that interaction. So that baby, it stretches the myometrium of the mother. Get the point? So now that stretch triggers the release of oxytocin. When oxytocin is released, it will come and bind on those receptors, on oxytocin receptors. When it binds there, at the end of the day, it triggers myometrial contraction. The same oxytocin has got part of the mechanism of action on the myoepithelial cells, on the myoepithelial. I forgot the cell, epithelial cells. These cells are located in the mammary gland, in the breast. And again, this takes me to something that we talked about on the prolactin. We said prolactin is also known as mammotropin. It is called mammotropin because mammary gland, it works on the mammary gland for secretion of milk. So it is also called mammotropin, oxytocin, or lactotropin. Not oxytocin, but prolactin. Sorry, yeah. So oxytocin on the myoepithelial cells, it triggers the myoepithelial cells contraction so that milk can be ejected out. If you don't get it, forget about it. You'll get it in heaven. This one is. The second messengers are IP3, dark, and calcium.
The second messenger.
Why are they calling them the second messengers? Because they're the ones that are triggering the effect. They are activating PKC, they are also being direct on the plasmic reticulum. They can open the channels. They are called second messengers because they're not the ones that are doing action. They are the ones that are doing the second action. You get the point? But the first action is done by oxytocin. By activating this thing and trigger all those cascades of reactions. And finally here.
So these only works.
What? No, there are different types of hormones and we discussed them in the introduction.
No, like,
The GQ.
yes.
No. So I said they are a class of hormones that work under this pathway. If you go back to the physiology of the GIT, wait, you asked me a question, I'm answering your question. So in GIT, we talked about CCK and secretin. So we said secretin is through CCK. Wow. Secretin is CCK. Wow, this one, the CCK is the GQ, which is phospholipase C. And that is the common MCQ in GIT, the hormone. So you just have to remember them like that. So whenever they mention something like CCKMD, you think of what is happening at the molecular level. It has reached